back to our Unclenched podcast. Today is a podcast that gets a lot of response, so we decided to have another question answer podcast. And these questions came from you, the listeners. So I'm really excited about this one. These are really my favorite podcasts because we can just sit and chat and
I
kind
love
of
these. Me too.
Yeah. But first, we got to see what Priya's doing. What's going on, Pri?
Oh gosh, so much. So I am excited to tell you that my husband is actually in Kansas City, Missouri right now.
No, don't tell me.
He is observing Dr. Raman do a full mouth reconstruction.
Oh, nice.
I know. I love it. So he's completed LVI Core 1 and Core 2, and he's going to go through the whole thing. And then he's getting this one-on-one experience with Dr. Raman, who's kind enough to just let him observe, come and watch.
Yeah,
and so Dr. Raman did ask him to come be there by yesterday afternoon so they could discuss the case, look at pictures, look at everything beforehand. And then today is the day of the actual preps. So I texted my husband a little while ago and I said, "How's it going?" And he goes, "This is awesome."
Wow. He needs to come to ICMO too.
Oh, I'm going to drag him there. It's just, the kids are so little.
Yeah.
So once they're a little bit older, then we'll both I'm going to drag him there. He doesn't know that yet, but, and he never watches our podcast.
Yeah.
Probably sick of my talking head. He's hear it every day.
He's like, I get this every day at home.
So he's not going to know that I said this, so I'll drag him there.
Oh my God, that is great. That's great.
I'm really excited to hear what he says when he gets back, because he hasn't met Dr. Raman in person yet. He's heard about him through me, but now they're hanging out without me. And I'm like, this is crazy.
I know, it's like a little FOMO because you're not there, but that would be great. I think he's going to get, I went years ago to Dr. Raman's office, I don't know. It was years ago, maybe
to observe also?
Not to observe, but to, this is what happened. So I'm just going to be quite blunt and, it's common knowledge to a lot of people, but I got kicked out of LVI.
Okay.
So, yeah.
Why?
Yeah. So why? And I don't care if this stays on the podcast because the truth is truth. So I got kicked out of LVI because there was a teacher there, Sam, who was a great mentor to me and just a great guy in general. And he and I were taking a TMD mini residency down in West Virginia. And after that residency, then I ran out to do a class at LVI. Then I come back to the residency and I'm like, Sam, he was one of the head instructors. I'm like, where are you? Why? Oh, I didn't see you out at LVI. What's going on? And he's like, oh, Alex, so he got nixed from teaching rather suddenly, whatever. And he's like, and nobody can hear my story or anything. I'm like, oh, sure they can. And he's like, how? I said, you write your story down in a little thing. I'll put it on the email because they nixed him from the forum. They wouldn't let him say his piece on the forum. I said, I'll just put it out. You send it to me and I'll forward it to the forum and we'll go in kind of the back door. And I just went, he's a great gentleman. So then when that hit the forum, I got kicked out immediately. And the head of the place at that time was Bill Dickerson. And he called me everything but a white girl. And but I'm like, I don't think it's right when if a hygienist leaves my office and people say, where's she going or what's going on? I tell them the truth, but nobody's ever left my office. So that says something about it other than if they were going to be a mom or, I've never had any hygienists leave other if they moved, whatever. But, so I got kicked out of LVI. So once I got kicked out of LVI, I'm like, I still have to learn more. And I went through everything and got my fellowship and paid all the money and time and effort and all that kind of stuff. And then when I called another great clinician, Brad Durham down in Georgia. He's now retired. I'm like, can you put together a class for me, I'll bring other dentists, I'll have them come, blah, blah, blah. And, you know, he made a lot of money from that, but it was so informative. It was worth every penny. And I asked him a question about a scan. I'm like, Brad, what's that line mean on that scan? And he's like, well, I don't know. And I'm like, what do you mean you don't know? You're supposed to be teaching me. So then after I left all his classes, I went to Prabhu. And I'm like, Prabhu, I need to
Mm.
know more. I need more. I need more. And he's like, well, Alex, I'm like, so I'll tell you what, I'll get a couple doctors, I'll get their team, we'll come to your office. And he's like, well, I was kind of thinking of doing that. So I was the initial class when he started because I made him, I
Wow.
pushed him. So I'm like, okay, we're good. So
I
yeah,
love
so
that.
we went out there to Kansas City for like 3 or 4 classes with my team.
Yeah.
And he got us all, you know, so now I felt like, okay, I got it all. I got it all now. But,
Yeah.
you know, we're
Yeah.
still learning, going to ICMO and all that kind of stuff,
Yeah.
learning new
Well,
things all the
can
time.
I ask you, were you, like, sad when you got kicked out? Or were
I
you
was
just like, "Fine,
devastated.
whatever"? You're
But looking
oh.
back, you know how things happen for a
Yeah.
reason, or, you know, when a door closes, a window opens, or
Sure,
whatever
sure,
that
sure,
thing is.
sure.
And, when that made me, though, learn from other people. So it made me learn a little bit different this and a little bit different that. And now I kind of have my recipe that has evolved for me from all these other great people. And I don't have anything against LVI. I think they actually did me a favor because, like I said, it just made me push myself more and
I
open my
get it.
mind to a little bit more different thinking sometimes, but still the same, but just maybe little tweaks here and there. And
Interesting.
yeah, like it's fine. And you know, but I know that the hierarchy has changed over there, and you
Oh,
know,
I think it's totally different from, like, what you're describing in a good
yeah, I
way?
think it is now. Well, where it goes back, I'm old too, so it goes back quite a few years, but um yeah, but even a couple years ago when I was bought a new laser in my office, the class for training on the laser was through LVI, and I said to the Nate that was selling me the laser, and I'm like, Nate, with the laser came extra learning, and it was through LVI, and I said, Nate, they're not going to let me take a class there. And he said, why? I said, well, probably about 12 years ago, this is what happened, blah, blah, blah. And he's like, oh, they're going to let you. I said, well, I'm telling you this, if they don't let me take the class there, or not there, but it was online, but it was through LVI, I said, then I'm not buying your laser. Oh, Alex, it's going to be fine. Well, he had to fight tooth and nail to get me in because I told him, I said, Nate, I got the box. I can box it back up and I can send it right to you. And he's like, no, 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 you don't have to box it up. I'll get you in that
My
class. But he didn't
gosh.
fight
Yeah.
for me to get. I'm like, all these years later, he's retired. What are you doing? Still picking on me. But yeah,
Yeah.
so there you have
Wow.
it.
You know what? With all our talks, we've never talked about that.
Yeah, yeah.
Wow.
Yeah.
Know
So,
that.
but I stood up for what I thought was right.
You did
And,
the right thing. Oh, I
you
totally
know,
stand by you. Like, I probably would have done the same thing too, to be
yeah,
honest. So,
he was just an important part of my learning. And, you
mhm.
know, there you go. And nobody got to know where he went, what he did, whatever. It was all hush hush. It was silly.
It is
Silly,
silly.
silly.
Silly
But
Pilly.
anyway, we got questions to get
We
to.
got
I
questions.
know, you know, we got to get going. I wasted a lot of time there. So let's just come and dive right in. So this first question, I suffer with TMJ and I've seen many specialists and they've recommended a night guard, but was charging 3.6. Oh, okay, 3,600 and insurance doesn't cover. Do you think it's better to get a night guard or Botox that is covered by insurance? Huh. Well, first, money's everybody's reality. Everybody always, that's the thing they say, that's a lot of money. But it's really your health and it's the reality. And I think insurance, I always tell patients it's just a coupon. We will submit it, maybe some x-rays, maybe something will be covered, but companies haven't increased their allowances for god how many decades, and I can't afford to accept what little insurance will pay for the procedures I do, and it doesn't even pay to cover my overhead or salaries for my girls, so I don't accept any. But sorry to go off that tangent on insurance. I can't stand insurance, but I tell my patients that, like, I don't like to get in bed with anybody but my husband. So I don't get in bed with insurance companies. So now to answer what you said, personally, I don't think night guards work because of how they're made. Dentists are taught, and Priya and I have talked about this before. When we were in dental school, you take an impression of your top teeth, an impression of your bottom teeth, or a scan if you have a scanner, and you melt a piece of plastic over the teeth and trim it up, give it to a patient. How's that feel? Oh, a little high here, a little high here. And you shave it down. It's so arbitrary. I can't even believe I used to do that back in the day, but I did. And
I
most
know,
people don't
right?
yeah. And most people don't tolerate it, right? They'll say, "Oh, I threw it out. It ended up in my bed. It's never in my mouth when I wake up." And Botox, once in a while, I like it for high pain patients just to break that pain for temporary relief so we can get things going. But with Botox, I can't always treat if it's early on because my muscles won't read correctly when we do the EMGs. But I think that only covers up the real problem. And I think you got to get to the problem. I know it's a lot of money. I know it's can be hard for some people, but people have always told me after they've paid for services, and Priya, I know you've probably heard it, like, I would have paid 10 times more just
Mhm.
just to feel good again.
Yeah.
So what do you think, Priya? How do you answer that?
Well, I want to take it back to the insurance thing for a minute because I know you touched on
Okay.
that. And,
Sure.
I think Luigi Mangione really blew everything out of the water with insurance. Like, I think that many of us healthcare practitioners have recognized that, like, insurance companies are not our friends. They are for profit companies. They are not to help the patients. They are not to help the practitioner. They're cutting fees every single year, like dental insurance
Right.
companies doing the same things, right? And then the
Right.
CEOs of these companies are taking home huge bonuses, like $10 million, $4 million, $5 million, and
Right.
at the end of his life, they say that the United Healthcare CEO was worth $42 million. Whether that's true or not, if it's
Yeah.
around there, nobody needs $42 million. Like, you might want it, but what I'm saying is that I think people are waking up to the fact that, like, insurance companies are not their friends. Like, the public is waking up to that, and that's really key because something has to change. Like, this isn't a system that works. And so, again, insurance companies are not our friends, especially when it comes to TMJ, TMD. Like,
Mhm.
medical insurance, in my opinion, should cover it. It's a medical problem. It's muscles and
Mhm.
joints that are acting up.
Mhm.
And it can be
Mhm.
caused by the way the teeth come together, right?
Mhm.
So I think what happens is medical insurance is like, well, that's not my problem. That's the bite. So dental insurance should cover it. And dental insurance is like, that's not my problem. The muscles and joints are acting up. So I just think it's this, like, cycle that's never ending, and so it's no man's land and nobody covers it, and it's not okay. So that I wanna say first, and then second, I never start with Botox because it paralyzes the muscles, and
Right.
the 2 ways I treat, I have to take really precise muscle readings, and so
Mhm.
if the muscles aren't firing, I'm not gonna get good readings, right? So
Right.
I never start with Botox, and then a night guard is not the same as a TMJ orthotic, and I have so many videos on my YouTube, my TikTok, my
Mhm.
Instagram talking about how they're different. But basically, a night
Mhm.
guard protects the teeth. That's all it
Right.
does. It doesn't treat the muscles and the joints, and an
Right.
orthotic does.
Right.
So, first off, I would say to this person, figure out which one it is. Is it a night guard, or is it a true orthotic? And
By a
kind of then,
neuromuscular dentist who's looking
yes,
at the
exactly.
joints, the muscles, and the teeth.
Yeah. Yeah. I had
Yeah.
a patient recently that got an appliance made from, someone in the same state as me, and it was basically just a sleep apnea appliance. He
Mhm.
arbitrarily jacked her jaw forward, it made all her
Sure.
pain worse, and she's very upset. She's like, "You told me I was gonna get better, and I got worse," and so it's just turned into this big thing. So it's like anybody can say they make an orthotic, but that
Right.
doesn't mean it's a good neuromuscular TMJ orthotic.
Right.
So
Right.
that's the tricky part, and it really, really, I think is unfair to patients because they have to do so much of their own research to flesh
Right.
out, like, what's real, what's not, who's a good doctor, who's not, who's just
Right.
sucks.
Right. Well, the one other thing, though, I'm going to add just back to that insurance because that always gets my blood boiling. Um, when you go down to town somewhere, the biggest buildings always an insurance company. Nationwide, United Healthcare, they're always there. And the other thing is you know how you have dental insurance and you have medical insurance and you have eye insurance, okay?
Mhm.
Since when aren't the teeth part of the body that they shouldn't be under medical anyway?
I
Like,
know.
how
I know.
many times are people saying, "Oh, this, your periodontal disease and heart disease and diabetes and all of this in a
Alzheimer's.
connection, but then we're going to cut it off and we're only going to give you a grand or two to take care of that."
Mhm. I never even thought of it that way.
Well, it's part
Like,
of your body, and
it's
it
part of
should
your
be,
body. Yeah,
yeah, yeah. So why do we have to have the delineation of whoever
sure,
thought of that? I want to meet
sure.
that man.
Yeah, I'm with you, girl. Like, I didn't even think of it that way, so now you've given me content for, like, 5 more videos. Thank you.
Oh, there you go. Woo-hoo.
I love that. Okay, so let's get to the next question. It is, can TMJ cause teeth pain? So, yes, there are muscles that can refer pain into the teeth. So it almost feels like your tooth needs a root canal or it's infected or it needs to be taken out. And it's actually all referred pain from muscles. So certainly, yeah, tooth pain, gum pain, um,
Yeah.
those could certainly be a part. What do you think, Alex?
Okay, so had a great patient, Emma. Emma, 23, came to my office. I think she had 7 root canals done. Root canal, then a root canal, then a root canal, then a root. All these root canals, right? Within a year. Okay, this isn't over time. Did she even have decay in those teeth? No, not at all. So when she was in my office and we did a workup, the poor girl was in a lot of pain. We're finally getting her a few levels down, but she even had a tooth extracted here and there on the lower because of this pain. When
Mhm.
I would palpate her temples right here,
Yeah.
guess what? Her pain referred to her front tooth where she just had a
Mm.
root canal. And the pain would go away for a little bit. And the reason, and I called the endodontist up and I'm like, okay, we got to talk here. We got this 23-year-old, no cavities, but needing all these root canals. Well, she's got this pain and they're reacting to my sensitivity tests that I do. And I said, I understand that. So what's happening is that muscle's referring pain to the teeth, and it's making the teeth get sensitive or reactive. So the pulpitis, it's getting a little inflamed. So yeah, there's a little pulpitis, but it's reversible. At this point, it's reversible. So next time she goes to him, she calls me on the weekend and she's like, okay, I need a root canal. I know you said no more root canals, but I need a root canal. I'm like, you've got all these other root canals and nothing else has gotten better. Why do you think this one root canal is going to get you better? So
Mhm.
she went to see him and he wouldn't do the root canal. And then she came back to me and I'm like, you need some muscle work. So we did different palpations. We did different kind of relaxing of the muscles and trigger point and stuff like that. And our pain goes away. We used cold laser and what have you. So, you know, tooth pain is definitely related to the muscles. Not always. If you have a big blown out cavity, you got tooth pain. So yeah, I do agree with that for sure.
Yeah.
So what's and you can relate it to muscles. And if you would go on, like, just look up trigger points for SEMs,
Mhm.
this muscle here, it'll show you what teeth the pain goes to. And I show my patients these all the time, and then I push on that muscle. They're like, yeah, that hurts. I'm like, that's where your pain's coming from. So we got to
Mhm.
figure that out.
So
So
interesting. Yeah.
yeah, it really really is. And yeah, so What's the treatment for TMJ? Well, there's kind of not an easy answer for
I
that.
know. I
My
know.
treatment's neuromuscular, and because you can treat different ways. So with neuromuscular treatment and the approach, we're looking at the muscles, we're looking at body alignment, we're looking at the neck, we're looking at the teeth, we're looking at the joint, we're looking at so many things. So you can be treated different ways. It's not everything for one. So it can be a neuromuscular orthotic, it can be orthodontics, it can be DTR, disclusion time reduction, that Priya and I are well educated into that, and do that a lot in our
Did I
office.
tell you I got my fellowship?
Oh, good for you. So you and me, we're both fellows.
I love it.
That's good. Good for you. So what do you think? When someone says what's the treatment for TMJ, that's like a
Gosh, I mean,
loaded
yeah,
question.
it's such a loaded question. There's different things will work for different people, right? And so, my 2 primary methods of treatment are, one, the orthotics, and I do a lot of hands-on therapy, and then the other way is DTR, which is disclusion time reduction therapy. And, there have been patients that were seeing me for, like, a year, and they were making some, like, progress, but they would plateau. So, we checked to see if they were, like, candidates for DTR, and they were. And so almost everyone I've taken off the orthotics, and it's been, like, 3 people, so it hasn't been a ton of people that the orthotics
Yeah,
don't work
yeah.
for.
No, I've
Yeah.
done the same thing.
Yeah, yeah, they have had, way more relief and significant changes in their pain in a good way, once we started the DTR. So I feel like there's no one solution that'll fit, like, everybody, right?
Right,
Because TMJ can be coming from so many different things. It can be coming
right,
from your bite, it can be
right,
coming from your neck, it can be coming from your hips, it can be I mean, there's so hypermobility is a factor, hormones are a factor. There's so many different things that can, like, contribute to it that you can't always, like I said, there's not a cookie cutter approach.
right, 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 right. So when I started with DTR, I was like a little skeptical or a little timid, like I didn't want to get too much done or whatever. But now it's like, and once you get your fellowship, like I said, it's like so amazing at people's reaction in the shorter amount of time that you can kind of reel these people in, and you don't know what you don't know. So it's great. I think it's great.
Yeah, and I think it was if anyone's been watching this regularly, you'll remember the episode where I learned about DTR and I, like, got off this podcast and I immediately ordered all the stuff I needed to and set everything up. So it's like, now we're, like, many months later after that, and I've seen a significant change
Yeah,
in the way I
yeah.
practice in the
I
best way.
know.
So
I
thank
know.
you.
I love
Thanks,
it.
Alex. It's because
Oh, you're welcome. You're welcome. So I got a question here, and this is yes to both of us. Do you do virtual consults? We do, and you do too, right? We both do.
Totally, yeah.
Yeah, yeah. Because a lot of people travel to both of us, and a lot of times you're like, is that the right fit? Am I crazy? But I think virtual consults are great too, just because patients then can realize that this is a possibility. Of
Yeah,
course, we don't have x-rays, or we don't have close-up photos, or we don't have a lot of the records, and we can't really diagnose you over a virtual consult without
yeah.
having more things to look at. But a lot of people that do virtual consults, I think it's a peace of mind to know, like, okay, I'm not crazy, or okay, my gut was right. This pain is from my TMJ, and maybe there's where you're from, there might be someone in your area that we know that we can refer you to, or what have you. But I just think it's nice for just kind of the peace of mind.
Yeah, yeah. I think, with the virtual consults, I always say if you do come here, we do a full physical exam. I don't
Absolutely.
skip that, right? And so I say whatever, and my physical exam, like my new patient exam, don't include imaging. So it's a very similar cost to the virtual consult. And then if you take treatment, we take the CT scan. So that might be
Mhm.
different from how I don't know if you do it
Yeah.
differently, but
We take
um,
imaging. We
at your
take a
first,
lot of
yeah, many
imaging.
people do. Many people
Yeah.
do. And so, because I don't, the cost can be a little bit lower for my initial exam because I don't do
Uh-huh.
imaging, right? And so I always say if you get an online consultation and then you come here and you know you're going to take treatment, we do the full physical exam, but I don't charge you for that because you already paid for the online one,
No,
right?
that's
So,
nice. Yeah.
well,
Yeah.
yeah, I mean, it's just it's
Right.
it's just doing the physical exam to confirm everything we already talked about.
Right,
So it's
right,
like
right,
an extra, like, 20 minutes, and
right,
then we move on and get all the imaging so I can really confirm my diagnosis,
right,
right? So I give
right.
him, like, a differential diagnosis, and then we do a full-on diagnosis, and we go from there. So I think
Good.
it's a little bit different. Yeah, I mean,
Yeah.
yeah, so that's how I do it. But,
Yeah.
yeah, basically the answer is we both do virtual consultation.
Right. Right, right.
Um so here's the next question. Can cracks on the tooth under the gum line occur because of misalignment of the teeth?
Yeah. I in fact in when I lecture I have this one picture of a woman that had it wasn't a crack like a crack vertically. It was the tooth structure was going in, they were getting like an indent into their tooth structure, which we called abfraction. So when found that on the exam, her gums were high, right, and normal. But when I went down, I dipped into this hole, and I'm like, "Woo, what's that?" So we lasered that tooth structure, I mean that gum tissue away, and found this big abfraction. It looked like a V going into her,
Whoa. Wow.
and that was all due to her bite. And then you pull out the T scan and you verify it. And you're like, look at all that pressure you're putting on your tooth. And it was under the gum line. And she's like, oh my gosh, like, how'd
Yeah.
that happen? And a lot of people, when they see those V's in the teeth down at the gum line and the tissue's, the tooth's tissue's hard, it's not a cavity. A lot of dentists say, oh, you're brushing too hard. That's you're brushing too hard. And I'm like, dear Lord, you take an extra soft bristle, you can rub it on your leg all day long and you're not going to cut it, right? So what
Mhm.
makes you think you're going to take this hard enamel away just by brushing? But
Harder than bone.
definitely,
Harder than
definitely,
bone. Yeah.
yeah, the way you're hitting, if you're not putting the forces down the tooth directly and the way you're hitting, you can splinter those teeth. Or if one tooth has too much occlusal force, it can be a virgin tooth and you can still crack it or cause nerve damage. So yeah, I think so. What about you?
Oh, yeah, definitely. I think the way the teeth come together is gosh, it can impact everything. It can impact your
Right,
joints, your muscles. It can
right.
make your teeth crack. It can cause abfraction. It can cause recession.
Hmm.
I remember when you got into a little online argument with Doctor.
The one
No,
that called me the R word, that doctor.
that guy is weird. I'm just saying. I'm not going to say his name, but
Oh my god, that
yeah.
was
So
that was kind
that
of
was an
funny.
interesting
Yeah,
little
yeah.
argument you got
Someone called
into.
my
But
office that day and said, "Is Alex okay?" And they're like, "Oh my god, she's laughing back there. She's fine."
she's fine. Yeah, I knew you'd be fine. Like you don't take that stuff to heart, and he's
No, no, no,
he's
no.
known as a weirdo in the dental community. So I don't think
Yeah, yeah.
nothing to
So
get upset about there.
I know, I know. Well, here's another question. This is on from TikTok too.
I've been really, really struggling with TMJ pain, and I'm all the way in Tennessee. Traveling to get treatment with y'all, unfortunately, isn't an option for me. Do you have a doctor in Tennessee you recommend? I don't know anyone in Tennessee. I wish I did. Do you, Dr. Alex?
No, I've had a couple people ask about Tennessee, but no, I'm so sorry.
Sorry,
But
I
go to the
don't.
ICMO website and maybe you can see if there's somebody in Tennessee that maybe we just
Yeah,
don't know.
that we don't know of. Yeah.
Yeah.
So, next question.
Yeah.
I currently wear an orthotic, but was told to wear it at night with no mention of a step two. Um, so you can take that one, Dr. Alex.
Okay. I think this is where we differ a little bit. I do have my patients that there are three options in my office. One is wear the orthotic, but it's still 24/7. And I do want you to function with it because when you take it out to eat, I feel you can displace a little bit because you're used to one way, the joint's in
Mhm.
one spot, and then we move it to another spot. So if they can eat with it, I tell them to try that. I think that's best, and that's how I did it whenever I wore an orthotic too. And that can hold you for a very long time. You may have to get it replaced, but who cares if you're in good shape and you feel good? That's what you got to do. If you want a step two, maybe they can refer you to someone that does do a step two, and that can be orthodontics, or it can be um, building your teeth up with restorations, and go from there. But that's how I do it. So I have another question. What do we do if we can't see you? I say you need to cry, or try, right? Try to come
Mhm.
and see us. We both have patients that travel, and if you can't travel, go to again the ICMO website and see if you can find a doctor in your area, or get in touch with one of us. We may have someone we know somewhere, and you know, but yeah, it's
Yeah.
terrible. We can't have a place in every state. We can't have an office, huh, Priya?
Yeah, well, I have created a course. I don't know if you know this, Alex, but I've created a course for dentists, that's limited to, like, 12 dentists. So I've had a few sign up, and my goal is to train dentists in other states, in other nations, so that they can treat TMD so people don't have to travel to see me.
Now, did you have to get, like, approval from your state to do that or anything?
I have, like, CE available, so
Mhm.
I've done all the stuff I need to, like, to lead.
Yeah,
Yeah, I'm just encourage your dentist to take the course. If you can't travel to see us, reach out to us and see if we know anyone in your area. Um, and then look in your area to see if you have any, like, TMJ physical therapists, TMJ massage therapists, or upper cervical chiropractors. I mean, that's something
right,
you can do at least. And people
right.
have said, like, they've reached out to me on my YouTube channel and said, because of your YouTube channel, I found an upper cervical chiropractor and I'm feeling so much better. So what
Good.
if that's, like, the key for you is, like, getting
Right,
your neck taken care of, right?
right,
So you look for what you have in your area. If that doesn't work, then schedule an online consultation with me or Dr. Alex, see how much we charge, see if it's feasible for you to travel,
right,
because it depends on how much it's impacting your quality of life, right?
right,
So if it's like, on a quality of life scale, if it's like a 2 or 3 out of 10 and you can live with it, you probably shouldn't travel to see us. You
right.
you you might
Sure,
be fine. You might find
sure.
relief in your area. You might just be able to live with it, whatever. But if it's like a 9 or 10 out of 10, you can't live like this. Come see us, and we're here to help. So yeah, any advice on correcting a wonky jaw? Wonky. Will acupuncture help? A night guard made it worse as I was chewing it all night, and a consultant recommended that I meditate more.
I don't mean to really laugh, but meditation is great and stress control is great. But if your jaw and your hard structures and your muscles are wonky, you've got to try to fix it. Acupuncture may help to hold things at bay, or maybe loosen up a couple trigger points and help you out. But if you have hard structure, teeth and jaw that are wonky, then I don't think a night guard is gonna help. I think you need maybe a little bit more than obviously meditation too, because that will relax you. But if you're in a lot of pain from the jaw, like, that's a hard question, and I don't know how to answer that. It's just a little bit too vague. So when you guys want to send questions, maybe just get a little bit more
Yeah, wonky is like a
info.
hard it's hard to interpret,
Yeah,
but,
yeah,
and if a night guard made it worse, that's something I hear all the time. It's like, "I got
yeah,
this night guard and it made everything worse," because
yes,
it's not appropriate to treat muscles and joints that are like the muscles and joints that are contributing to the pain and the dysfunction. So, seeing a TMJ dentist, preferably a neuromuscular TMJ dentist that can help you, I think that's the way to go. So, yes, next question, Alex. I'll let you ask it.
Okay, is it normal to feel bottom teeth discomfort when wearing a sleep orthotic? Okay. So again, I don't know what it looks like, and this is just my opinion. When people come to me with a sleep appliance and it feels tight or makes their teeth discomfort, um, I'll adjust some on the inside. A lot of times, that's all it takes. That nighttime or sleep appliance was just a little bit too tight. Typically, though, if it was made at another dentist, I have them go see that dentist. But if they're like, they don't care if I adjust an appliance, then I'll do that. And I think the other cause can be if your tongue is pushing those teeth at night, you're going to get sore teeth. So you got to look a little deeper and look at what is your tongue doing at night, because that will make the teeth sore too. And when you're saying bottom teeth, I'm thinking it's in the front, but it can also make, if the appliance has your bite funny, you can be clenching on it and that can make your teeth sore. So yeah, it's not normal. None of my people that have sleep appliances have teeth that hurt them. It's not normal. Something needs fixed or looked at.
Yeah, I feel like if the teeth are hurting, it's usually because the appliance is too tight around those teeth. That's usually number
Right.
1. And then number 2, it's like hitting the opposing arch too much. So there's usually something that can be adjusted to correct that, right? So taking that to the person that made it and talking to them about it, I think is the best way forward. So let's see. Next question, maybe the last one. Um,
Okay.
what is the difference between a dentist-made night guard and a TMJ orthotic, and what is the price difference?
Oh, I don't know what dentists charge for their night guard. I don't make night guards. I only make TMJ
Me
orthotics,
too.
so you only have one thing to choose for at my office, and it's hard to say what other people do in their office. But the big difference is, again and again and again, is that the way it's made from a neuromuscular dentist that looks at your muscles, looks at your teeth, look at your joint, your posture, and all the other stuff. The price, they're expensive. I'm not going to lie to you. You can start anywhere in my office. I don't even know. I want to say 5,500 and up is what I'm thinking, but somewhere around there. But that's the price of one. So yeah, it's expensive, but the price of being out of pain, it is just such a
Yeah.
blessing.
It's also, the jaw joints are the most used joints in the body, and I think people forget that. I think, we just use them all the time. We don't even think about them, right?
Right.
And of course, they're gonna need some maintenance for most of us, and they're definitely gonna need maintenance if your bite is throwing everything out of whack, per se, right? And so, I think most dentist-made night guards go anywhere from, like, I've seen them anywhere from, like, 3 or 400 to, like, 1,000. And a TMJ orthotic, I've seen anywhere from, like, 5,000 to, like, 10,000. I've seen 10,000. So I've seen the price be a lot more for a TMJ orthotic, and people say, "Well, they kinda look the same." But if you think about it, like, all eyeglasses look the same, right? And they fit the same, but it's the prescription built into them. So a night guard is like reading glasses that you can go and get anywhere. You can go to any drugstore and pick up reading glasses and kind of, like, put them on and hope they work. Whereas if you go to the right doctor and get the right readings, like an ophthalmologist or an optometrist, and they take very specific measurements of your eyes and get you the perfect glasses for you, the perfect prescription built into the lenses for you. That's what makes all the difference. And so it's the same thing. A TMJ orthotic has a prescription built into it that is unique to the individual wearing it. And a night guard does not have that. And so that is the difference. And that is why there is a price difference. You have to have a lot of training and certain instrumentation and technology and software to find that prescription. And that is what you're paying for.
Right.
So that's
Right.
the big difference.
Right. 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 Okay, last question. Went to a TMJ dentist. Oh, okay. Wore an orthotic, and now my bite is even more out of line than before. Is there any way to fix my bite and return it since my orthotic created space?
I'm
Well,
gonna let you take that.
yeah. First thing you've got to do and you've got to know is like, yeah, it did create space because you were wearing it. But if you're out of pain, why would you want your teeth to return to how they were? okay, you created space, because I know when I had my orthotic and I took it out, it's like I only touched a little bit in the front, but I never wanted my back teeth to come together. I liked the balance. And when it did, it just felt so uncomfortable. I'd put my orthotic back in and be like, oh my God, okay. So I just don't understand, if the orthotic got you out of pain and you're comfortable, why would you want to go back, number one, and getting your teeth looked at to go more to a permanent solution like restorations or orthodontics or sometimes DTR. Priya and I both have done that, depending on how long you've worn the orthotic and what's happened in the joint. But, there are different things you can do, and maybe you just have to have a conversation with your dentist and go back to and see what they can do or they can offer.
Yeah, and I think, you make a good point. Like, why would you wanna go back to that bite that got you into all the pain in the first place? And I think what many people think is, I went through years of ortho to get this bite. I don't wanna pay for ortho again. But it's the bite that probably caused the TMJ dysfunction in the first place. And I think that's where the disconnect is. Like, I had a patient early on when I started working with my mentor. I still remember her. And she had pain, clicking, popping, everything was like just acting up a lot. So we made her an orthotic. She comes back and she's like, every time I take it out, my teeth don't come together. Why are you changing my bite? I already went through ortho. She was probably in her early 20s. I'd never want to do it again. I hated braces, this, and that. And she's like, I just want to be done. And I explained it all to her. And she was like, I don't care. I'll just live with the pain and the clicking and the popping. But I want my teeth to touch how they were when we started. So I said, stop wearing it. You haven't even been wearing it that long. So your
Right.
teeth will drift. It'll probably all
Right.
just go backwards,
It
right? Like, a
will.
lot of
It
orthotic treatment
will.
is reversible. Yeah. And that's kind of the nice thing about what we do. A lot of the treatment is reversible if people wanna stop. And her teeth, they did. They went back, but she was just so mad, and I was like, it was hard for me to wrap my mind around it, because we know the science behind it. We know the structural issues behind what the bite can do. But for people that have been through ortho and paid for ortho, they can't get past that sometimes.
Right.
Right?
Right.
And they're like, "Well, I already paid for
Yeah.
this, and now my teeth fit together, like, they fit together perfectly, and now you came in and my pain's gone." "Yeah, but now my teeth don't fit together, so why'd you do that?" And I'm like, "Ay, ay, ay." And I explain it. It's in all the paperwork and the informed consent, but
Well, of course, but sometimes too, when people come to your office and they're in so much pain, they're not paying attention to
I
what
know,
you're
I
even
know.
saying. They're just like, okay, hurry up, let's get started, get me
Sure,
out of this pain, and that's of
totally.
course what we want to do. But we want you to be well informed, and that's for sure. So, well,
Sure.
we got to wrap it up for this one.
We'll see you guys next time, friends.
See you next time.